today we're going to continue with our integumentary, meaning skin disorders. Make sure that you are filling in the answers into your guided notes. At the end of the PowerPoint, when your guided notes are finished, that's what you're going to send in to me today as your assignment. So dermatitis. So derm means skin and itis means inflammation. So what would you guess dermatitis is? Nailed it, skin inflammation. So this is actually one of those umbrella categories, but what this curriculum is going to consider dermatitis is actually something called contact dermatitis. So dermatitis really means anytime your skin gets pissed off about anything. Any sort of inflammation of the skin is technically dermatitis. But this curriculum is using it to mean contact dermatitis because they mean dermatitis when something has contacted your skin that you're probably allergic to. So like soap, a lot of us might have some contact dermatitis right now from washing our hands every 14 seconds. Healthcare workers get that a lot. Different chemicals, latex, some people are latex sensitive. Adhesives like Band-Aids, some people will break out because of Band-Aids. It's usually at the site where something is contacting you, and that's why I'm saying that they mean contact dermatitis. So it could also be a new lotion. A lot of times people will have allergic reactions to new laundry detergent, and so it's kind of all over their body, and that one's kind of tricky to figure out. Also, it is itchy and red like this. This is probably to soap or possibly latex gloves. If it goes on for too long or is too bad, it can dry and crack the skin, and even blisters if it's really severe. So you see right there in the top picture, this is obviously contact dermatitis to this bracelet. I don't care how cute it is, get rid of it, don't wear it anymore. So treatment is get rid of it, don't wear it anymore. So, switch to a different laundry detergent, stop using that soap, avoid latex, quit wearing that bracelet. Again, this is where your immune system is freaking out to something. So if it's really severe, we can give you a steroid, either a cream to go on your skin or a pill steroid to take if it's all over, because steroids calm down your immune system. Eczema. So very quickly going to touch on eczema. Don't freak out about it. Eczema is a type of dermatitis. You always have eczema, but you're not always having a flare-up. So it's chronic, but you're not always experiencing symptoms. The difference between this and contact dermatitis is that you have eczema in random places that don't have anything to do with where you're being contacted. It's usually something that's irritating you still, but a lot of times we can't figure out what it is because it's not at the site of contact. So this tends to be red or brown, itchy, flaky areas. Again, it doesn't have to be something that touched this person right here. Something is upsetting their body and they're freaking out right here, regardless of where it happens. Sometimes it's temperature, sometimes it's weather, sometimes it's food that they're eating. It's all sorts of different things that it can be. This does tend to be in the bins of things. So like on the inside of the elbows or on the inside of the back of the knee that you see here. Treatment, again, steroid cream. I swear, dermatologists get to just like say, oh, I don't know, here's a steroid cream, and that's it. Steroid creams treat darn near everything in the integumentary world. So any itch or just steroid, because again, this is your immune system freaking out to something. Herpes. So herpes, there's two different types. It's a virus, both of them, herpes simplex virus, but there's type 1 and type 2. Type 1 causes cold sores. So fever blisters on the outside of the lips. Almost everyone by the time they're like 50 or 60 has been exposed to HSV type 1, herpes simplex virus type 1. Even if you don't break out with cold sores or get fever blisters, you probably have been exposed to it at some point in your life and have just built up immunity. People who do get these, usually it's when they're stressed or tired or getting sick. HSV type 2 is genital herpes. This type 1 is not a sexually transmitted infection, an STD. Type 2 is. So that is herpes simplex virus type 2 on a penis, and there it is on the labia of a female. As you can see, they are spread via contact. 1 is not an STI, 2 definitely is an STI. So I always think everyone has one type of lips, but there's 2 different types of genitalia. So 2 is the one that affects the genitalia and is an STD. You can get type 2 on type 1 spot, and you can get type 1 in type 2 places. It just doesn't usually happen like that. Tingling, itching, and blisters. Just so you know, any STD that starts with an H, you have it for life. There's no cure for it. So HPV, herpes, HIV, all of those are all lifetime things. So there's no cure for this. You can take an antiviral pill that decreases how long you're broken out with these blisters, but it's not going to take this away from you. You'll have it forever, and you'll always be capable of spreading it to other people. Impetigo is a bacterial infection of your skin. It's usually caused by staph or strep. These are just two different types of bacteria. So what I want you to take home here is it's really contagious, and it has to get in through broken skin. So it's usually a honey-colored crust. So you get this red sore, and there's this honey-colored crust because it makes this yellow oozy stuff that dries up. And that's generally impetigo. Because it's bacterial, we treat it with an antibiotic, either a cream or a pill. Psoriasis is similar to eczema in that it's one of those things where your skin's freaking out, but we can't really figure out why. Psoriasis looks like this. So it's this red spot with these white flakes over it. These tend to be more so on the outside of. So eczema was like inside of your elbows and inside of your knees. This is like outside of elbows and outside of knees. Still itchy and burny. So it's idiopathic. We really don't understand it that well. Our medicines try to kind of help it, but they don't stop it or prevent it or cure you of it. It's a chronic, lifelong thing, and you'll have breakouts every now and then. Ringworm. Ringworm is fungal. It is one of the few things that we can catch from animals as well. So you can catch it from touching someone who has it, from touching an animal who has it, or touching something that someone has touched who has it. So it's very highly contagious. Direct contact we call, when you touch the person or the animal, we call it direct contact. When you can catch it from just touching something they've touched, like a doorknob or a chair or something, we call that indirect contact. So this is ringworm. It's not really a worm people used to think it was. It's a fungal infection. If it's darker red on the outside and then there's a slightly clearer center, that's usually ringworm. It can be small in just one place, or, oh dear God, it can look like it's taken over your body. Because it is a fungal infection, you can get an antifungal, either cream or medicine. So if it's small, you've only got a couple of them, usually you can get an over-the-counter cream from Walgreens or something like that. But if it's like this, I surely hope this man went to the doctor and got a pill. Again, not a real worm, it's a fungal infection. Scabies are the most disgusting thing in the world. They're tiny little mites. So in the South, we have like chiggers. You can think of them like tiny burrowing chiggers. So, that's what it looked like. Ew. Super, super contagious. Super, super, super contagious. I knew a doctor one time that when a patient thought they had scabies, he would not go in the room with the patient. He would send the prescription in with a nurse and tell the nurse to give it to him. Because, screw the nurse. Severe, severe, severe itching, drive you insane itching. It's kind of like lice that burrow up under your skin. You can kind of think of it that way. The tiny bumps that you see aren't bites, they're tunnel marks. They tunnel up under you, and everywhere that they're tunneling, you get the little red bumps on the outside of the skin. You treat them with a cream. You have to put the cream on super thick, and you spread it all over your body, and it has to stay there for hours and hours and hours. And then much like lice, you have to treat all the linens, the bed sheets, the pillows, things like that, either scalding hot wash them or put them in bags. And so that if the scabies don't have people to eat on for a few days, they will die. So you have to bag everything up for a few days so that it doesn't have any source of food, and then they will die. Super, super, super nasty, 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 nasty. I itch just talking about them. I'm scratching right now. Shingles. I think we talked about shingles in the neuro system. So herpes varicella zoster is the one virus that kind of has two different parts to it. So originally it causes chickenpox. And then after you've gotten over chickenpox, the zoster part of it, the varicella was the chickenpox, the zoster part, it goes to sleep in your nerves. So it can lay dormant, meaning like sleeping in your nerves. And then generally, once you're 50 or older, or anytime that your immune system is compromised, like when you have chemo or something like that, you can break out with shingles from it. So it's inflammation of the nerves. So you have painful, burning red rash of blisters along a nerve tract. So as you can see, first of all, this is the guy's nipple. This is a blister. All of these are tiny little blisters everywhere. So there's a nerve that comes off the spinal column and goes right here. And that nerve is the one who is affected by shingles in this person. Again, this is the nerve tract. So notice that it goes all the way across, but it stops at midline. Right in the middle of the patient, it stops. So that's because, remember, this nerve only serves the left side of the body, and then it would have another nerve serving the right side. So if the rash crosses midline, like it goes all the way around you, it's probably not shingles. Shingles only affects one side of the body or one side nerve tract. You take antivirals to decrease it. It is super, 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 super painful. In fact, I heard one time that shingles pain is one of the causes of suicide in the elderly because it's so bad that they will take their own life. There's a shingles vaccine. You can still get shingles after you've had the shingles vaccine, but it's supposed to make it be not as bad. Skin cancer. Okay. I will link this video somewhere for you. It's a super cool video. Skin cancer you get from sun or fake sun. So sunscreen and tanning beds. It's the UV radiation from both of those. So your prevention is going to be stay out of the sun. Dear God, do not lay in a tanning bed and always wear sunscreen. Consider all non-healing skin lesions skin cancer. So this means if skin lesion means any abnormal skin spot. If you have something on your skin and it's getting worse, not better, assume it's skin cancer until a dermatologist biopsies it and tells you that it is not. So there's three main types of skin cancer. We'll touch on these first two, but what I really want you to learn is the malignant melanoma. So again, these are the first two. They're usually not life-threatening. Malignant melanoma is just as likely to kill you as any other cancer. So that's the one we're going to spend most of our time on. So again, basal cell carcinoma. A lot of times it looks like this. It's a shiny little crater. Least malignant. This is my girlfriend in nursing school. She had basal cell carcinoma. This is her calf. It's right there. So a lot of times we'll say that this is from or on places where the sun hits, but this was on the back of her calf. So it doesn't necessarily have to be. Again, usually on the face where the sun hits, but doesn't have to be. We're going to cut this off, freeze it out. Usually we'll catch it before it's spread anywhere. It doesn't usually spread anywhere. It won't usually kill you. Squamous cell, again, a little bit worse. Oh dear God, yeah, that's a good little bit worse, but it still usually doesn't kill you. I will say that this guy, I mean, by the time we're measuring it and putting it in a textbook, it's usually a pretty bad case. Again, raised red nodule usually won't kill you. We're just going to cut it off. Malignant melanoma. Malignant melanoma is cancer. I mean, it's cancer. People don't take skin cancer seriously. Take malignant melanoma seriously. It is the most dangerous type of skin cancer. It is just as likely to kill you as any other cancer. We used to think that it had to be in a mole. We now know that it can start anywhere. So sometimes it's a mole and the mole will start to change, but you don't have to have a mole to get malignant melanoma. So first of all, this is like a 5 o'clock shadow in a guy with high testosterone levels that haven't shaved today. This is the malignant melanoma. So the symptoms are A, B, C, D, E. A means it's asymmetrical. It's not the same on the left side as it is on the right side. It's not the same on the top as it is on the bottom. It's not a perfect circle. It's asymmetrical. B is irregular borders. So you see how this is like squirvy and curvy and there's not a smooth border. That's the B. C is different colors. Look how this spot's dark, that spot's dark, this is a little bit lighter, that's dark, that's dark. Multiple colors is one of the signs. And then diameter is bigger than 1/4 of an inch. So from one to the next, from one side to the next is bigger than 1/4 inch. E means evolving. So it used to just be A, B, C, D, E, and then we added the E. Again, evolving means it's changing. If you have something on you that's getting worse and not better, please go see a doctor. So surgical removal, and if you notice here, we've added chemo. So this is cancer, people. It can spread, it can go anywhere, it can kill you. Again, lesion is anything that's abnormal. Please don't stress about these. I'll say them, but don't worry about them. Macule is like a freckle. It's a fancy word for freckle. Papule is a solid raised thing. Like if you've seen these on people, those are papules. Pustule is a fancy word for like a pimple, anything filled with pus. And then ulcer. I do want you to learn ulcer. Ulcers are, this is called a canker sore. This is not the same as herpes simplex virus 1, the cold sores on the outside. These are canker sores. They're ulcers on the inside of the mouth. And this is usually like you bit the inside of your lip. I will get these anytime I'm starting to get sick. My immune system freaks out and will overreact to any tiny little nick on the inside of my mouth, and I'll get these. Ulcer is a depressed lesion, not like it's sad, but like there's a depression, a holdout, an eaten out part of you. Does that make sense? It's missing. You got a chunk missing. And then a vesicle is a blister, basically. Again, of these, what I really want you to know is ulcer. Speaking of which, ulcer. So decubitus ulcer is the fancy name for a pressure ulcer. A lot of times we call these bed sores. If you lay too long without getting up and moving around, the pressure from the bed on your skin can cause an ulcer. Now, generally, this only happens in people who can't move because they're paralyzed or they're in a coma, or super, super old people whose skin is really fragile anyways. So it happens in 4 different stages. This is stage 1. This can happen within just a few hours. I know like when you cross your legs and stuff, a lot of times you have a red spot, but the difference is when you push on that, it should turn white. This is erythema, meaning it's a red spot that is non-blanchable. If I were to push on this, it would not turn white, and that means that blood supply to the area has gone downhill. This is stage 2. It's going through the epidermis and down into the dermis. This is stage 3. If you can see that yellow, that's adipose. So that's gone down into the subcutaneous tissue, and that's stage 4. This is a leg, this is a leg, this is a buttocks, and this is the patient's back. My guess is that that's the patient's scrotum. So here, 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 and here. These are the heads of the femur, or the bottom of the pelvis. This is the sacrum. This would again be one of the pelvises, the iliac crest laying down. So this patient was laying flat on their back. Anywhere that there's a bony prominence generally, or skin is rubbing up against itself, like this is inside of the gluteal fold, that's where it starts to break down. So we turn patients constantly in the hospital. If they are neurologically impaired, meaning they don't know to move themselves, they're in a coma or something like that, we have to document that we have rotated them, like left side, back, right side, back, left side, back, right side, back every 2 hours. We avoid friction, which is why we move the whole sheet you're laying on when we scoot you up in the bed. We don't just pull you up in the bed because that rakes your skin up against the sheet. And then healthy diet. These people are going to be on so much protein. This is really, really difficult to heal. This one we might heal. That's going to be difficult. This is not going to get better in this patient. There are special types of dressings that we can put on them too. They're fancy dressings that mimic skin. It's not just like a gauze dressing. All right, warts. Warts are actually viral lesions. You do not get them from a frog peeing on you. It's a virus. It's called HPV. There's tons of different strains of HPV. There are some that affect hands, some that affect feet. There are, all of them are contagious by being touching someone who has it, or touching something that someone has touched who has it. So again, direct contact or indirect contact. They're small, rough bumps. So let me show you some pictures so that you can understand it better. So this is on a toe, I believe. So this would be plantar. These are on palms. These are palmar. And then did I put a genital? I did not. A genital would be on the genitalia. So this and this, these are not STDs. They have to be on the genital area to be an STD. Usually they will disappear on their own eventually. Some people are super embarrassed by them and they'll go and have them frozen off or cut off by dermatologists or at home kits. Just so you know, cutting off this does not get rid of the virus. So they can absolutely come back just as soon as you remove them. Okay, guys, that's it for today. So make sure you fill all of this into your guided notes, and then share those with me, send those in to me on Google Classroom for your attendance for the day. That's it. We're done with skin.